So what's your financial approach?
In regards to what type of patient base we see or how patients finance care?
Yeah, like how do you what's your approach and how you build revenue in your practice? I mean, on the most part, your biggest service obviously is going to be adjustments. And
Mhm.
the providers, which are your insurance companies, are the ones that are pretty much paying the bills, your patient pay copays. I mean, that just seems like that kind of financial model. But you also have, you said that you did away with a lot of the extraneous stuff. Do you also have other services that, kind of add into the profit?
Well, yeah, just to kind of back as far as patient finance care. So obviously, it's a lot of insurance,
Hmm.
but a lot of those patients, as soon as we meet our goals and we finish our treatment plan, those patients, thankfully, are usually converted into self pay.
Great.
That's how we phrase that, self pay. Um, we do personal injury, car accidents. We still do that whole thing. So all of that, in a sense. But in regards to financial, in addition to chiropractic services, I do still make recommendations. I do still advise the use of this and the use of that.
Hmm.
But now it's more so by special order,
Hmm.
right? Instead of me stocking it, it's now by special order that we will order different products that individuals may need. We also use some of the dispensaries that are available for different products. So I still do stock some, but the ones that I stock are the ones that generally do move pretty quickly. When it starts to get a little bit more into specifics, I right now I'm using the full script, which bought Elevate that I had been using prior to. And I really like that because I don't necessarily have to stock anything, yet I have all of these products at my disposal. And because I'm not investing in anything to have it on my shelf, whatever percentage the doctor still keeps for themselves is all profit. And so we've actually done quite well with the use of the dispensaries. Um, Through the dispensaries, you can also do lab testing. And so because a lot of my patients, again, because they're on a wellness journey, they will actually have different tests and labs that they would like to do, but their medical doctor may not necessarily be offering. And so through these dispensaries, you can also do that. And so we'll charge our consult fees to kind of go over labs and things like that with the individual. So that's a source of income as well.
Gotcha. Okay. Um, so describe what is a dispensary?
So my understanding of these dispensaries, and there may be other ones as well, but ultimately it is a portal that you are able to set up as a provider, and give access to either just your patients, or you can make it to where anyone can actually access your link or your store. And they're able to go into these dispensaries and you can make recommendations. Like if there's someone who's having back pain, there might be certain supplements that I recommend, natural anti-inflammatory or things like that, that you recommend. And you can send them the recommendation and they're able to just purchase it as is. They can modify it. Um, as well as now with labs. You can attach labs to the order. Or these individuals can just go into the dispensaries and it's kind of like I say the big box store of professional grade supplements and different products. So if it's a product that they have already started taking, they can normally go into this particular dispensary and purchase it. And each provider is able to determine if you want to actually give your patient a discount if they use your dispensary, or if you don't, you kind of set up your store the way that you want to. But it's just a way to have access to all of these products because there's no way I could stock all of these different brands that they have, for different conditions or different needs. But again, depending on how you set up your store, you're actually able to get some reimbursement for going through the portal. And depending again, sometimes they will use your HSA cards. Patients can pay that way. So a lot of patients actually really like it. The product is shipped right to your door. You can be certain that it has been stored the way it's supposed to be stored, as opposed to ordering it from some of these places online. So, yeah, patients have really taken to it, and I really prefer it because, like I said, it gives me greater access to more products than I could actually stock, and there's no risk for me really involved.
Yeah, yeah, and it work out so well because they just ship it right to the patient store, and then you don't have
Mhm.
things going bad on your shelves or inventory that gets dusty. It's a nice thing.
And the likelihood of repurchasing, right? Because depending on how you set it up, the patient is reminded that it might be time to repurchase, right? And so it also keeps them consistent with the different products that they actually really need. So yeah, I really feel like the dispensaries have been a huge perk for my practice as well.